The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
It's often referred to as a labor of love, but for those assuming the responsibilities of caregiver, frustration and exhaustion can result. But understanding the role of caregiver can make the experience a cherished one. As millions of Americans die from coronary heart disease, why isn't prevention more of an issue? Is taking proactive steps the answer? Ear infections are quite common in children, and often surgery is the only solution for relief. But fortunately, new eardrops administered during surgery can make ordinary hospital stays into outpatient procedures. Fluoride, it helps prevent tooth decay. But what if it could restore tooth enamel? Stay tuned as we explore this topic and all the others next on Today's Health. This program is brought to you in part by Pfizer, Daiichi Pharmaceutical, and Enemalon.
Where do you find heroes these days? The media spends a lot of time searching the ranks of athletes, movie stars, and politicians. But a more productive search for true heroes might be better spent focusing on the caregivers of this world. Hello, I'm Faith Daniels, and this is Today's Health. Self-sacrifice, hard work, loyalty. Those qualities aren't as rare as you might think. Every day, millions of people all across this country are caring for loved ones who are battling difficult diseases. Some of these battles can be as tough on the caregiver as they are on the patient.
With the advent of new drugs and healthcare technologies, people are living longer than ever before. Often, however, friends and family members are disabled or otherwise homebound, with extenuating circumstances that make it difficult to get into hospices or group homes. In these situations, family members and friends often decide to take on the role of caregiver.
5 years ago, my husband couldn't follow instructions. If I asked him to put something away, he would sort of wander around looking for the places to put it. He found it difficult to understand what I was saying, and I couldn't understand why he felt that way.
My husband and I have been married 48 years. He has Parkinson's for 18, but was able to manage it very well, didn't shake. He did have dementia, slightly, but he was able to manage until one day I discovered he couldn't comprehend how to take a pill. So from that day on, about 2 years ago, I started putting him in day centers when I wasn't home, and it was really never a decision what to do.
According to a 1996 survey conducted by the Alzheimer's Association, caregiving can sometimes take up to 100 hours a week. And nearly half of those surveyed said that caregiving duties can cause stress within the immediate family. More importantly, though, fully 96% of those surveyed agreed that theirs is a labor of love.
This is my life now. I take care of him fully 3 days a week usually.
A lot of times people begin to take care of folks because it's expedient, it's necessary, someone's become ill, and they need to learn how to do it. They need to learn how to primarily balance their real needs in life with the person that they're taking care of. Far too often the caregiver becomes absorbed into a 24-hour-a-day, 7-day-a-week activity, and they end up having no life of their own. This is not good.
Most caregivers find their job is never-ending. For example, a survey by the Alzheimer's Association showed that 63% of the caregivers surveyed do not expect loved ones to be cured of their diseases.
I don't know how a person could just say, well, he has Alzheimer's, just let him rot away. I mean, how could you? It's beyond me.
Accepting the role of caregiver can bring many additional responsibilities and duties into your life. It can also, though, bring a great deal of happiness, joy, and self-fulfillment. Understanding the role and all of its challenges, as well as your own personal limits and needs, can help make the rewards as plentiful as the responsibilities.
It's important that people who are the primary source of care for a family member or friend know that they are not alone. There are organizations and groups for caregivers, such as the Alzheimer's Association and the National Family Caregivers Alliance, that deal with all types of patients. Experts also agree that it is important to find support groups that offer help for legal, financial, and lifestyle changes, caregiver stress, as well as information about care options.
The support groups provide an enormous amount of psychological support to each other. And so you don't go through this alone. And that is, I don't even know what word to give to it. That is more than worth its weight in gold.
Programs such as Triad by Eisai Incorporated and Pfizer Incorporated is a support program designed to provide information and resources, books, videotapes, and newsletters to help the person with Alzheimer's, the caregiver, and healthcare professional in managing the day-to-day realities of Alzheimer's disease.
There have been times when I felt that I wanted to give everything up, but then I know that I can't do that because he's my husband and I love him and I want to take care of him.
There are so many questions you may have when caring for a loved one. Sometimes there are no right or wrong answers. Most of us just do the best we can.
I find that everyone is very understanding, the public. I mean, I found it very difficult, taking him into a men's room. And I found that the men and the women have been, everyone seems to understand.
There are many programs and resources available to the caregiver. Local phone directories, libraries, and the internet can provide valuable information and the numbers to support groups. Joining a local caregiver group and using available community resources are key to making this a viable option.
Caregiving can be a tremendously rewarding thing because you are providing an improved life for someone with dementing illness.
Being a caregiver is, in a sense, is rewarding because I know that he depends on me and I'm the most important thing in his life.
A caregiver should credit themselves for a lot. It is the ultimate in sacrifice quite often. It is more than a full-time job. It is a job that is not usually rewarded by the person they're taking care of. I mean, if the person has extreme dementia, they're not going to come back and say thank you very much.
Well, I remember rolling down these bright lights over my head going into an emergency room.
Tragedies such as fatal heart attacks are often the direct result of neglecting your health. With proper prevention, a tragedy of the heart could be avoided altogether. But what exactly is considered proper? We'll find out next on Today's Health.
How serious is the problem of heart disease in the United States? Well, consider this. About every 34 seconds, it claims another life, making it the leading cause of death in the U.S. And what makes that statistic even more tragic is that heart disease can be prevented.
Heart disease is not just the #1 killer of men and women in the United States, but it is also one of the most preventable.
The bad news is that approximately 950,000 Americans die of cardiovascular disease each year. The good news is the amount of available information that exists on how to prevent it. Unfortunately, neglect is the #1 contributor to this disease.
Heart disease is often referred to as a silent killer, #1 because it's so prevalent, and #2, often patients don't have any symptoms, suggesting underlying heart disease.
The known risk factors for heart disease are cigarette and tobacco smoke, high cholesterol, high blood pressure, physical inactivity, obesity, diabetes, and family history. Most people don't normally realize they have high blood pressure or high cholesterol. Setting goals for blood pressure, blood sugar, and cholesterol levels with your physician and monitoring them regularly is one way to keep track of your health and potential risk of heart disease.
I woke up with this, I thought I was having a terrible case of heartburn. So I went into the kitchen and I made myself an Alka-Seltzer, hoping that would help relieve it. And it didn't get better, it got worse. When it spread through my shoulders and down my arms, I got scared.
You always hear, well, it's the other guy the other person that's going to have this, and why did it happen to me? But as time went on and I found out that, hey, this was something that I probably could have prevented had I paid more attention to some of the signs that led up to this.
Two of the biggest preventative measures for heart disease are diet and exercise. Studies show that moderate exercise, such as walking 3 or 4 times a week for 30 minutes, can substantially decrease your risk of coronary heart disease, as well as obesity and high blood pressure.
I didn't do any real exercise, such as maybe bicycle riding or going to a gym, work out a couple of times a week. And I had the opportunity, but I never did.
There are many programs that your healthcare professionals can recommend, like the Pfizer for Living program and website, which helps people over 50 take a more active role in their overall health.
Diet and exercise go hand in hand to improve one's longevity. Even moderate amounts of exercise have been clearly shown to improve one's outcome. There's been studies in elderly people. There is no age cutoff, that the benefits of exercise are prolonged and cannot be overdone.
It is important to note that taking any action may be better than none at all. Remember, always talk to your doctor before beginning an exercise program or changing your diet.
What many people don't realize is that women are affected by heart disease as often as men. In fact, the number of women it claims far exceeds the toll from breast cancer. But it doesn't matter if you're a man or a woman. Taking the proper steps to prevent heart disease could save your life.
Dietary habits are an extremely important ingredient to prevention of heart disease. Start by reducing the consumption of fat, especially saturated fat and cholesterol.
If you're not at your ideal body weight, achieve and maintain it through diet and exercise. Also, you may want to increase your consumption of complex carbohydrates such as vegetables, dietary fibers, and whole grains. Reducing the intake of sodium and alcohol needs to be discussed with your doctor.
My lifestyle before the heart attack was I lived on cookies and cake. This was lunch. Cigarettes, fast foods for dinner. I've cut out all kinds of cookies and cakes and things like that, cigarettes. I don't drink sodas like I used to.
In some cases, medication may be warranted to manage a patient's health risks. The important thing to remember is to take your medication as directed and ask your physician or pharmacist questions about your medications and possible side effects.
Patients have to be in charge of their own health, whether it's with diet, with exercise, with medication. Certainly, I think today, the ball has to go back into the patient's court, and they have to be involved in their own care.
Be proactive. Taking positive steps to prevent heart disease is imperative, but knowing the warning signs of the disease can prevent and limit damage if one strikes. Intense, prolonged heaviness on the chest, pain radiating from the chest to the left shoulder and arm, back, and even the jaw, and shortness of breath are some common warning signs.
Heart disease can manifest in many ways. People should be wary if they know they have risk factors and they feel any unusual sensation that's prolonged, that goes on for more than 20 minutes to a half hour. They should seek assistance at that time.
While some patients may be able to control their cholesterol or diabetes with diet and exercise, they should always consult their doctor first, as they may need medication to help manage their condition and should have a physician supervise changes in their fitness and dietary regimens.
When a heart attack strikes, time is absolutely of the essence. The sooner somebody seeks medical attention, the sooner life-saving therapies can be delivered.
You're put on this earth for X amount of time, and you try to make the best of it. And when something like this happens, then you say to yourself, boy, I'll be given a second chance. Let me be a little more cautious out there.
Physically, I feel wonderful. I absolutely feel wonderful. I can do so much more than I did before. I mean, to go for a walk and go 2-3 miles is wonderful.
For the child, it can be extremely painful. For the parents, it can cause grave concern. Ear infections. Often they can get so severe, surgery becomes necessary. But a new antibiotic development can help make the surgical procedure an easy one. This topic next on Today's Health.
Can you guess the #1 reason why people visit the doctor? Surprisingly, it's for an ear infection. You may be familiar with the fact that some infants and children can have ear infections, but the problem is not simply one you can outgrow.
The clock is ticking. The baby's crying. It's very late, and it's another long, sleepless night. Ear infections, specifically called otitis media, are the second most common disease seen by physicians treating children. They are painful, can occur frequently, seriously disrupt the child's and the parent's sleep patterns, and can cause hearing problems if left untreated. More than 2/3 of children will experience acute otitis media by their second birthday. Children who experience their first episode early in their first year of life are considered otitis prone and may be subject to frequent recurrences.
Heather is only 7 months old, and in her 7 months, she's already had 3 ear infections. And with each one, I'm up a lot during the night. She wakes up at 2 o'clock, 4 o'clock, 6 o'clock, whereas before she would sleep from 8 at night till 7 in the morning straight through.
There is an outer ear, a middle ear, and an inner ear. And ear infections can affect either one of those 3 parts. One type is what we term recurrent otitis media, where these are children usually that obtain infection that involves the middle ear, the eardrum, usually following a cold. And the infection gives usually pain, it gives fever. The children are usually then seen by the physician and treated with antibiotics. There are also otitis media with perforation. The infection becomes severe enough where the eardrum actually ruptures and drainage comes out through the external ear canal. These are usually more severe and need to be treated more aggressively with antibiotics. You then have children with chronic otitis media. This is an infection or an inflammation of the middle ear where the children will have fluid in the middle ear, and this fluid will persist for 1, 2, 3, 4 months, sometimes even longer. When these infections are chronic and do not respond to medical treatment, then sometimes surgical options are available.
If antibiotics fail and the fluid has been present for several months, insertion of a ventilation tube is often recommended.
We actually make a little incision in the eardrum. We place a small little grommet tube in the eardrum halfway in and halfway out, and the fluid can then drain through that. These tubes are usually not permanent. The eardrum will in time kick them out. This may last anywhere from 3 months, 6 months, sometimes up to 2 years.
As a parent, it's important to understand the type of infections your child may be prone to and the treatment options available.
Many ear infections can spell double trouble. There can be pain because of the pressure that builds in the middle ear, and there's also swelling that can block the eustachian tube. In order for treatment to be successful, it must deal with both problems.
No parent wants to subject their children to surgery, yet that may be the best option to help control ear infections and protect hearing. Ventilation tubes help the middle ear equalize pressure and drain fluid. This relieves discomfort and possible hearing loss and may prevent recurring infections. The ventilation tubes can often be the option that carries the least risk over the long term.
When we found that the ear infections were reoccurring on a regular basis with Savannah was pretty much antibiotic at first. But after a course of antibiotic, we found that it was reoccurring, and our further only option was to have surgery and have the tubes put in her ears to drain the infection out.
Ear infections can occur in patients with ventilation tubes, but are less frequent, less painful, and thanks to an effective antibiotic eardrop called Floxinotic, easy to heal. Developed by Daiichi Pharmaceutical Corporation, this eardrop allows direct treatment of middle ear infections in children 1 year and older with ventilation tubes.
Fortunately, since the advent of the pressure equalizing tube, we have seen a marked decrease in the chronic ear problems that we used to see before, and therefore intervention should be considered when medical therapy has failed.
For Jordan, there was the immediate release of the pressure on the facial nerve, and it's been 4 weeks since his surgery, and he has almost 90%, I would say, movement in his face now.
Not all ear infections are related to middle ear infections. Outer ear infections, called otitis externa or swimmer's ear, are painful and can be easily treated with antibiotic eardrops. The use of an effective topical antibiotic is often preferred to oral antibiotics because they may have fewer side effects and may be less likely to cause the child to develop subsequent infections with antibiotic-resistant bacteria. A child's hearing enables him or her to experience everything from the soothing strains of a lullaby to the roar of an approaching car. Sounds teach them a great deal about the world and how they interact with it. Fortunately, there are alternatives to help prevent infections from robbing them of this vital sense.
Want to know more? To find out information about any subject we've covered on this program, visit our website at vstar.com. There are very few things more endearing than a beautiful smile, and that's only one good reason why it's important to take proper care of your teeth. In the 50s, people started using fluoride to protect their pearly whites. Well, now there may be a way to help fluoride work even better.
Drilling and filling, it remains a staple of dental care, but today's emerging technologies may soon make it a thing of the past. That's good news to the estimated 40 million Americans who fear going to the dentist. According to the Surgeon General's office, tooth decay is still the #1 disease in the world, despite the introduction of fluoride in the 1950s. So researchers are continuing to explore exactly how fluoride works to prevent tooth decay. Some of that research is now producing practical results in the form of new dental care products and technologies. One such technology focuses on promoting fluoride's ability to help the mouth replace minerals that are lost from tooth enamel every day. It's a process called remineralization. This is important because every time you eat, plaque acids gradually dissolve or demineralize tooth enamel. If this demineralization is not balanced by remineralization, the tooth enamel weakens and can eventually collapse to form cavities, which can only be repaired by a dentist. Recently, researchers have found a novel way to help fluoride remineralize and strengthen tooth enamel.
The fluoride in everyday toothpaste remineralizes or strengthens teeth in a number of ways, but its effect is limited by the amount of calcium and phosphate that are in the saliva. This is because fluoride cannot work alone. It needs calcium and phosphate to replace the minerals that are lost when acids, formed by the breakdown of sugars in the mouth, attack your teeth.
For years I've had weak teeth. Every time I went to the dentist, there was another cavity or the beginning of one.
Scientists have discovered a way to add assured levels of soluble calcium and phosphate to fluoride in a toothpaste called Enemalon. The technology of this toothpaste enhances remineralization, providing a preventative treatment that rebuilds and strengthens enamel structure.
This is a new toothpaste that's out on the market now.
My last visit to the dentist, he recommended that I try this new fluoride toothpaste. After almost a year, I'm happy with the results. I'm confident with my smile. I can smile again. My teeth are nice and healthy and strong.
It's taken many years to try to find a way to combine calcium and phosphate into a soluble form so that the tooth can take it back in with the fluoride and remineralize itself. And only recently has this technology allowed us to do that.
Cavities are not simply a problem for kids. In fact, throughout your whole life, your teeth are vulnerable to the damaging effects of demineralization. Hopefully, advances in tooth remineralization can rebuild tooth enamel and help us all keep our teeth strong and our smiles bright.
Overcoming the obstacles of life can be a whole lot easier when we have good health and a positive frame of mind. If we adopt a healthy lifestyle, diet, and exercise habits, we may be able to avoid some challenges altogether and prevent a lot of others from slowing us down. I'm Faith Daniels. Join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.